in terms of looking back to our experience, I think the fact that the government had taken the early steps once we had a positive case in the country to establish a unified command and control mechanism for the prevention and control of COVID-19, and also a better coordination mechanism in order to make sure that not only government institutions but all partners involved in those efforts were on the same page in terms of guiding all the efforts towards the same goal. So I think that in my view, that was one of the things that lead us to contain the spread of the disease. The second important thing that I would like to also highlight here is, despite the fact that we took quick action on border closure, quarantine mechanisms, and isolation facilities, we faced a lot of challenges in terms of infection prevention and control, because we ended up having a few imported cases which we then realized that were the source of transmission within quarantine facilities. When, for example, by mid-May this year, some of the clusters were identified within some quarantine facilities, we realized that the challenge of infection prevention and control was not handled properly. And of course, after that, with the support of all partners involved, including WHO, the Australian government, all other governments, USA government, the China government, and all other development partners, we managed to improve a little bit on the prevention control mechanisms, and then contain further kind of let's call it nosocomial infection within the quarantine facility. So after that, I think quarantine facilities were better managed, including from a perspective of infection prevention and control. And I think that had led us to more than 90 days without any new cases detected. Only this month, August, I think, up until yesterday, I think 3 new cases were detected, making it altogether now 27 cases, 25 positive and 4 probable cases. And then I think up until today, we still have 2 active cases. The one last point for me is that government had made the decision to extend the emergency state starting from this month. The Council of Ministers had decided another extension for another 30 days next month. And that is because constitutionally, we have to have a parliamentary law to impose quarantine measures and border closure and so on and so on. Unfortunately, as you may also know, that our political situation went through some impasse throughout these last months, and unfortunately, Parliament was not able to approve the appropriate legislation to enable the government to avoid continuously declaring states of emergency. But that is still a tool used for the public health contention of the spread of disease. So far, border closure proper quarantine management and isolation facilities had led us to the situation that we are at the moment.